To discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to chemicals present in certain food items, allergy to certain medication, incense sticks, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. So today we are going to talk about urticaria, and it's in today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us renowned dermatologist, Dr. Sowmya. She is a dermatologist, trichologist, and cosmetologist, and she is joining live from Chennai. Dr. Sowmya will educate us more about urticaria and its management. A very warm welcome to you, Dr. Sowmya. Hope you are doing good, Doctor.
Yes.
As we know, the weather conditions in Chennai is not that good. But Doctor, first of all, we would like to know what is urticaria.
Understand what is urticaria in layman's terms. Allergies that come and go on your skin. That means you will have red rashes on your skin like hives, the wheals, the raised rashes. So what happens is once you have the patients will feel warm, all right? So they might assume it's a fever. No, it is because of the rashes, your skin becomes warm. And as soon as they eat like your cetirizine, etc., like fexofenadine, like lactocalamine, forever, and when the trigger is there. So basically, what are the triggers for an external trigger? So let's say external can be like a mosquito bite, an insect bite, okay? It can be some pollen allergy, okay? So whenever they like near the plants and they inhale over there, and immediately after 1 hour or half an hour, you know there was a trigger prior, okay? And your foods that you consume, for example, egg, seafood, colored food items, for example, paneer butter masala lovers for just example. Okay, so when we make paneer butter masala at home, we will not add any coloring agent to it. Whereas when we eat paneer butter masala in a hotel, they will add a bright color into it to make it look appetizing. But in return, that coloring agent might not suit everybody. Some of us might react like red rashes post the coloring agents, all right? So coloring when we consume these artificial flavors, just like your Maaza cool drinks, etc., which has artificial flavoring agents in it. So, and next your seafood. Some individuals are allergic to seafood also. So prawns, fish, etc. can also cause squid, can cause these rashes. Some are allergic to Chinese foods. So these Chinese seasoning agents can also cause urticaria. All right. So these are the like external causative factors. Sometimes some material does not suit some people. For example, some people are allergic to silk material, cotton, etc. So this is the external factors. Coming to the internal factors of urticaria. How does urticaria get triggered internally? Thyroid, pre-existing thyroid infection can cause it. Dental cavities can cause it. Okay, so any urinary tract infection. So when patients complain of burning maturation, even that can cause this urticarial rash. Okay, motion problem, like if any like infection in like passing motion, even that can cause urticaria. All right, so all these are internal things on the skin problem, liver problem. So these are the causes. It's not like this is the cause. You actually have to go to a panel of investigations in order to find out what is the cause of urticaria.
Now, with what you just explained, doctor, like what is urticaria, how does it look like, what triggers it, the external causes, the internal causes, it looks like everything and anything can trigger or cause urticaria. Now, my question is, rashes, itching, it's one part. But how serious can urticaria get? Is it a serious thing? or
Yeah,
disease?
see, divided in different categories. You have physical urticaria, pressure urticaria, okay? You have cholinergic urticaria, aquagenic urticaria, normal urticaria, which is called acute urticaria, chronic urticaria, depending on the history. See, aquagenic urticaria means water-induced urticaria. Somebody who's allergic to warm water, like they go bath and they come out, they have rashes on their skin. Okay, so that is called aquagenic urticaria. Cholinergic urticaria. Cholinergic is due to your sweating. So let's say they've worked out a lot in the gym or they were in the hot sun outside and they're sweating. Post sweating, urticaria can trigger. So that is called cholinergic urticaria. Okay, then pressure urticaria. So let's say you're sitting in a chair for more than 20 to 30 minutes. You develop rashes on your bum wherever the pressure has taken place for a longer period. That is called pressure urticaria. Okay, so acute urticaria. Acute urticaria is when you have urticaria in a recent onset, less than 6 weeks. Okay, chronic urticaria is more than months time, like 2-3 months. It's been you're continuously getting urticaria. That is called chronic urticaria. Then you have something called urticaria pigmentosa, which is basically mastocytosis, which is it's an autoimmune condition. It's more because of the mast cell accumulation. See what happens when itching is happening? Your mast cells are being accumulated. Because of the mast cells are being accumulated in one area, your brain is having a sensation to itch and you end up scratching your skin. Okay, so urticaria urticaria pigmentosa. Okay, then urticaria vasculitis is there. What is urticaria vasculitis? More than 24 hours, the rash is staying on the skin. It is not going away no matter what you do. That is called urticarial vasculitis. So in order to call a person, this is the type of urticaria you have to sit with them. Your history matters, the drug history, because some drugs can cause urticaria. NSAIDs, non-steroidal anti-inflammatory drugs, like your Combi, Flam, Zerodol, these are all non-steroidal anti-inflammatory drugs that can cause urticaria. So your history, anytime I have to sit and diagnose a patient with urticaria, it takes at least minimum 20 to 25 minutes of explaining why, because it's a psychological, psychologically they're very affected. Nobody likes scratching their skin on and off. They don't know the reason. If something stays on the skin, I can point out and say, you have a fungal infection, you have dry skin, use this moisturizer, use this fungal cream, it will go away, it will never come back. Whereas in urticaria, you can never completely satisfy your patient. Why? Because urticaria is due to multiple triggers. What is the trigger you're having? Time only tells, and analysis. Keep ruling out cause by cause. Okay, then only you can come and say, this is the reason for your rash. You understood, right? So that is the problem with urticaria. It is one condition in the skin that you cannot completely satisfy your patient.
Right. Now, doctor, as you said that urticaria can be of various types. One, broader verification or bifurcation could be on the basis of acute and chronic. You said acute, which is for less than 6 weeks, and chronic, which which is more than 6 weeks. Now, my question is, especially with chronic urticarial hives, how will they go away? Does they go away forever, permanently?
See, all right. When it comes to chronic urticaria, we do a test called ASSC, okay, autologous serum test. What is the serum test? We take patients 5 ml of blood. Centrifuge is a machine where your plasma will be separated and your RBC process. So in the centrifuge method, what happens is your plasma comes up, so and your blood goes down. So after 2000 RPM of centrifuging the 5 ml blood, we take 0.05 per 5 ml and inject intradermally into the skin. Okay, within like 48 hours, a bleb will be formed, a wheal. Okay. When a wheal is formed, you know they are positive for autoimmunity. So chronic urticaria. So in that situation, see, what is the treatment for urticaria? Mainly, first, we need to find a trigger. Initially, when a patient comes to me and they say on and off, I'm getting these rashes and it's been a chronic time, the first thing I tell them is ask them about their diet. What kind of foods they're taking. What are the common food triggers I just explained to you, like egg, seafood? I ask them, do they consume them in their diet? If they say yes, okay, there are two ways to ask. You like have a diary at home, note down what all food items you eat, okay, or you have skin allergy patch testing centers, meaning you just have to take a list of food items that you eat on a regular basis, on an occasional basis, what kind of cloth material you wear, what kind of shoe material you wear, etc. What kind of mattress you sleep in. So accordingly, they'll test those agents on the skin intradermally. So when you test those agents on the skin, you will have a rash forming. So when the rash happens, they'll have a measurement. If the rash is this much size, it is positive. So what happens is they will give you a test report which they says what you're allergic to. So you have to follow that report for lifelong. You can never say, can I eat those items? Can I use those items again? Because that is what is causing the trigger for urticaria in your body. All right. So that's the thing. Next is serum IgE level. So the serum IgE level tells me how stabilized your immunity is internally. So normal serum IgE level should be within 100. Okay. When it's more than 100, you know your body is prone to getting allergies. It can be internal trigger. It can be external trigger also. So when your serum IgE level is more than 100, what you would have to do is, you have, whenever you go to a doctor for any cause, you need to tell them, okay, you need to tell them, please, tell the doctor, your physician, treating physician, my serum IgE level is elevated. Do not prescribe me any high dosage. Why? Because let's say, for example, I have a cough. I'm going to a general physician. Okay. And my cough is like, I'm getting antibiotics for my cough. My serum IgE is normal, whereas your serum IgE is not normal. So when your serum IgE is not normal, it's elevated. Let's say, for example, amoxicillin as an antibiotic. Both of us are getting amoxicillin 500 mg as a dosage. If my body is allergic to amoxicillin, remember, my serum IgE level is normal. I will not react too much. Whereas if your IgE is elevated, when you take amoxicillin and you're allergic to it, you might have double the reaction that I'm supposed to have, because your IgE is simply elevated. So it's always to treat lesser. So tell your doctor, my IgE is elevated. So they'll give you a minimal dosage. If you're fine, no allergy is happening, inform the doctor 2 days later so that they give you the dosage according to your body weight. Okay, so that. And what are the normal symptomatic relief for urticaria? Your antihistamines, your itching tablets, topical calamine lotion. Sometimes if it's very severe, we do give short duration of steroid tablets. Short duration, never think long term. Short duration of steroid tablets. Okay. And then even if this does not work for you, there is called autologous serum therapy. How I told you, we did an intradermal test with the autologous serum to find out if you have autoimmune urticaria. Same method, instead of giving it intradermally, I will inject it into your muscle. Intramuscularly, your plasma is injected. So what happens is, the antibodies against mast cells are formed so that you're fighting your mast cells. So it is given as weekly once intramuscular injection, okay, for about a period of 9 cycles. So when you take your 9 cycles, at least for 1 year or so, your 10 months, let's say 10 months, your urticaria frequency will be reduced. Okay, so that is one type of treatment. The other type of treatment is histoglob injections, where your IgE immunoglobulin is injected intradermally weekly once. Okay, it is a preformed medicine. This is not your own serum. This is already comes in a vial. This will be injected weekly once intradermally so that your episodes of urticaria are delayed. It never means that I'm completely curing you. Complete cure depends on your luck, your body's immunity. It just means that I'm temporarily giving you a relaxation. Okay. Other antihistamines like fexofenadine, belastin, or more like levocetirizine with montelukast. Name the antihistamine, you can try on the patients. It's not like the same antihistamine we keep prescribing. We keep changing the antihistamines to see which one you're responding to. Because if we give the same antihistamines chronically for a long term, you might end up becoming resistant to it. It's like using, for example, when you use a shampoo. Initially, when you use a shampoo, it's all nice. 2 months, you use the same shampoo, you're like, I'm bored with it. I want to change the shampoo. It won't show you the same results it showed you in the first week of treatment. So same way, we keep juggling our antihistamines to make sure you're not resistant to your immunity doesn't get resistant to the antihistamines. So that is how chronic urticaria, mainly the trigger. You know where you can place the trigger. Once the triggers are identified, your exposure to this disease becomes more easy and you are able to understand how to control it on your own without visiting a dermatologist or a physician continuously.
Right. And so the bottom line is that there is no point in suffering silently. If you have these symptoms, please go and consult a good dermatologist. And don't waste your time in home remedies or over-the-counter medication, etc. Just go and contact the right person, which is a qualified dermatologist in this case. Doctor, we would also like to know that what are the potential complications of urticaria if left untreated?
See, it's not potential complications because it's not something that's going to stay on the skin for a long duration.
Right.
It comes and goes, but it is psychologically disturbing, right? Like, see, let's say you're in a crowd you're going for a party. You cannot enjoy your meals because you do not know what you're allergic to. If you do a skin allergy patch test, you have an idea. Okay, when I go to a party, if I'm allergic to egg, I should tell my friends, give me eggless cake. If I'm allergic to artificial flavors, I stay away from cool drinks. So it's a psychological disturbance because if you see the prevalence of urticaria, 15% to 20%, okay, suffer with urticaria in their life at least once or twice. Either it can be a bee sting, it can be an insect bite. Okay, see, when does it become very chronic? When you have angioedema involved. What is angioedema? It is swelling of the skin is urticaria. Right. When your cutaneous tissues start swelling, okay, you will have like your throat will have a choking effect. Your eyes will swell up, lips will swell up. That is called angioedema. When you have angioedema, it is an emergency treatment. Immediately, you need to go to a local hospital and get injected with injection steroids, or oral steroids have to be given compulsorily at that situation because someone can go into anaphylaxis. What is anaphylaxis? This is a big term. It is basically breathing issues. Your tracheal, your airway can be disturbed. For that one reason, steroids are a main indication for angioedema because we do not have a choice. Because steroids are, see, when I say steroids, everybody starts feeling, oh my God, steroids, I'm going to put on weight, I'm going to get diabetes. No. Sometimes steroids are life-saving when given for a shorter duration. Yes, when sleep every single day. That is when it is bad for your health. Whereas short-term period, like 2 days, 3 days, according to your body weight, just to reduce your infection, you can take steroid tablets if they are prescribed by a doctor. Without a doctor's prescription, you cannot buy steroids because someone can misuse it. And we don't want anybody to misuse it. All right, that is the point over here. Just because I said steroid, don't go buy a steroid and take it. Find out if your urticaria requires steroid.
Exactly.
So,
and again, for that, you need a good doctor. So please go by what your doctor is telling you. Trust your doctor. That's really important. And contact a qualified dermatologist at the first place. Don't waste time in over-the-counter medication or home remedies, etc. There's no point, again and again, we are saying the same thing, that don't suffer in silence. Why hamper the, quality of our life when treatment is there? Go and get relief. Yes, there is some network glitch again. So the bottom line is again that hair dye can also cause urticaria. Doctor asked due to network issues, we are not getting your voice properly. I'll move on to the next question.
Yeah, so basically what I was saying is, if you're a person who's very sensitive and you have fearful that you might get allergies, it's better to go get your serum Ig level tested to see how is your immunity status. Okay, even less hemoglobin. When you have anemia, even anemia is prone to getting urticaria. So if yes, any questions, ma'am?
Yes. So a viewer is here with us, Shri Sharma. And the question that our viewer is asking is, what is your advice for toddlers with urticaria?
See, toddlers with urticaria means definitely there's an asthma trigger over there, atopic dermatitis. So find out if they're atopic. So serum Ig level will tell you if your child is atopic. Okay. So if your child is atopic, your serum Ig level is elevated, then definitely you have to be very cautious in whatever you give them orally. So I would suggest first you have to do serum Ig level to find out if they are atopic, how sensitive they are. If serum Ig level is elevated, avoid egg. See, like toddlers, so after they're not going to eat yet. So are they lactose intolerant? Some toddlers with atopic, they cannot consume milk. Whenever they consume milk, either they'll get diarrhea or vomiting, or they might get rashes on the skin. So find out if the child is atopic. That is the main concern when toddlers have urticaria. And family history of asthma. If your family has asthma, obviously your child is prone to getting these skin allergies.
Okay. So, Shri, I'm sure you have your answer now. Doctor, one more thing, as with what you just told us, we can imagine how much, frustration, irritation, discomfort a patient with urticarial hives goes through, because he or she is continuously itching. There are people who end up avoiding socializing or going to family functions, etc., because they have this fear, as you very rightly said, that they'll start this having these urticarial rashes, and they'll end up itching. Now my question is, can urticaria be caused by stress? I mean, one thing is that is it going to get exaggerated or aggravated due to the stress, or can stress cause urticaria?
See, stress causing urticaria is very, alone causing urticaria is very rare. Like I told you, something autoimmune. So when your immunity reduces, it aggravates, right? It has a flare up. So when you're stressed out, your immunity is reduced. So in turn, you might get urticaria, because of already you're having the urticarial trigger inside. Stress is not an alone trigger for urticaria. Stress can aggravate the existing urticarial tendency to become more.
Right. And doctor, one more thing, many times patients complain that they, during night, their urticaria get worse. Why this happens?
Maybe they have something called pressure urticaria, or what they see. There's nothing called urticaria, doesn't have day or night. All right. Only has triggers. We need to look at triggers. Okay. Or if they're only having in the night time means, are they having pressure urticaria? Like lying down in the same position for a long time. So what you have is called pressure urticaria, because at night you have to lie down, right? So in case it's pressure urticaria, honestly, pressure urticaria is the most difficult to treat, especially when it comes to couples. Okay. So in that situation, what we have to tell them is keep changing position. Do not be in the same position for a long time. Take antihistamines before you go to bed, so that you are not releasing the mast cells. Okay, you're controlling the mast cells from being released. All right. So basically, we have to analyze history. Like I told you, do not just plainly tell somebody, take this, take that, you're done. Once we analyze and once we give them, see, for example, most of my patients who come with urticaria, nobody would have suggested them this skin allergy patch test. Very rarely they get the skin allergy patch test done. So when I suggest them the patch test, they have a solution. Instead of experimenting on them, take these medicines, come back, let's see how you're responding. Once we do a panel of tests, you have a clear idea. And psychologically, if I'm a patient, I'm going to a doctor, I want to know proper explanation. So once a proper explanation is there, your immunity automatically increases as a positive immunity. So half your problem is solved because you have a hope. Okay, I know my results are going to come. I will have a reason to why I'm scratching so much. So your immunity itself can reduce your agony a bit. It's like hand. It's like when we're upset, you want to call your best friend, and your best friend should give you good advice. They should be like, dude, it's okay. I'm there for you. Let's just analyze. Let's see what we can do to make you feel better. So the same thing, step by step. Understand why the patient is scratching. Understand their history. Are they taking any medicines? Like some antidepressants can cause urticaria. Diabetic medicines can cause urticaria. So look at their medicine history. Analyze everything. And then come to a decision. Say, okay, this is what you might be suffering with. This might be the trigger. Once I have a report in my hand, I can positively give you a feedback. Why exactly are you itching? Why are you not responding to treatment, etc.?
Right. So diagnosing the trigger, or, finding out the trigger is the most important part when we talk about the treatment of urticaria. Doctor, one more thing. Is urticaria contagious? Because many times, especially with skin infections, we have this idea that we will get it from somebody else.
It doesn't mean urticaria is not contagious. It is not a fungal infection. It is not a bad infection. So skin to skin contact whatsoever, urticaria person suffers on their own. They will not transfer it to anybody else unless there is a genetic trigger for all these things.
Right. And Dr. Sowmya, before we wind up, any take-home message for our viewers?
The take-home message is always, please do not self-diagnose yourself. Do not self-medications, because sometimes self-medications can be helpful, but sometimes they can be harmful also. So I would always suggest you, it is okay to spend money for consultation and see a doctor properly and understand what we have, instead of spending money without knowing what we have and going to a psychological pain that why am I not seeing relief? Why am I not seeing relief? So go to a good doctor who you're comfortable with and then proceed with your treatment. Okay. So basically anything, we are in 2022 right now, when COVID injections are there on the spot, definitely anything can be curable. I will not say complete curable, but different alternate methods are coming to give you cure. So always have a positive hope. Never be unhappy that you're suffering alone. Everybody suffers in their own different way of life. So be happy, stay positive.
Thank you so very much, Dr. Sowmya. It was wonderful talking to you, especially with the given weather conditions at your end, with all the network issues, etc. You still maintained to convey what you wanted to, and made us really enlightened about this whole topic of urticaria and its management. Thank you so very much, Doctor. It was wonderful hearing.
Have a good day. Thank you. Good night, guys.
Thank you. Yes, goodbye, doctor. And we are really looking forward for many more such sessions with you in the coming times. Thank you once again. And viewers, thank you for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Good day. Goodbye.